Ovarian cysts are fluid-filled cells that occur within the ovary. What happens is the cell fills with fluid, the fluid is able to get in but can't get out. This here depicts a normal ovary, whereas on the other side here what we see is an ovary with a cyst on it. For the majority of women who happen to have ovarian cysts, there is nothing to be worried about. Because the majority of cysts, as they do occur naturally, will go away in time. I mean, it's only the minority of women who have cysts that will go on to become cancerous or have accidents. Usually the symptoms are what we call chronic symptoms. So you have a niggly pain, which is usually located to one side of the lower abdomen, sometimes in the pelvis. And it may well be related to different phases in the menstrual cycle, depending on what type of cyst it is. And because of the anatomy of the cyst, some women actually describe pain that comes on and off, that radiates down the leg. Some women also find that they will have pain, or particularly on one side during intercourse. In the extreme, however, some women will notice sort of pressure symptoms if the cyst has grown to a very large size. So they will have problems with their bowel, problems with the bladder, and other sort of pressure symptoms. Others might notice weight gain, and some women in the extreme might notice a little bit of weight loss, and those are usually indicators that something needs to be done about the cysts. But the majority of women shouldn't worry about cancer. But before the menopause, very few cysts are cancerous. Then after the menopause, a lot of them can be cancerous, so that is when we normally pay attention to them. It's important that when women do get symptoms that they visit their GPs early, so their GPs can organise for them to have scans and blood tests. The symptoms are not symptoms that should be ignored. Once the scan's done and the blood test done and the pointer is that the cyst is benign, then GP or the doctor looking after them might advise that they wait a little while and have another scan. And should the cyst clear up, that is usually the end of the matter, with a very little risk of recurrence. And if it doesn't clear up, then intervention may well be required. If the cyst is of a certain size, you may be advised to have a laparoscopy. That is done under general anaesthetic. And all it involves is putting a little camera through a very small incision under the belly button. And that allows the doctors to look at both tubes and both ovaries to make sure that everything is okay. So that's a cyst there. And then basically what has happened is the cyst has twisted on itself. And if that were to stay there for a very long time, then the ovary will be starved of blood supply and kill itself. But luckily enough, this woman has presented early. If they do find that there is a cyst on the ovary, they then proceed to remove the cyst laparoscopically. For the majority of women, this operation will take between 30 and 45 minutes. It allows quick recovery and has no detrimental effect on future fertility.
For more information, visit www.nhs.uk.